Great. Thanks everybody for joining us today. So we're going to go ahead and get started. Welcome everyone and good morning or good afternoon, depending on where you're joining us from. Today we'll be presenting on our second session of our community of practice on tobacco use and cancer prevention for people with disabilities. In today's session, we will be focusing more on partnering with disability-led organizations. This community of practice is presented by the National Center for Health and Public Housing and the Disability Network for Tobacco Control and Cancer Prevention. So closed captioning is available to support the accessibility during today's session. To turn it on, you must navigate to your Zoom toolbar and click the Show Captions button indicated here as A with the yellow arrow. And once the captions are enabled, you can also adjust your settings by selecting the drop-down menu labeled as B with the blue arrow, or you can choose your preferred caption language, such as English, and access additional caption options. We encourage you to enable captions if it enhances your learning experience for today. So before we continue, this is just a few quick housekeeping items. All participants are muted upon entry, but we also encourage you to engage in the chat throughout the session. If you'd like your line to be unmuted, you can also just raise your hand and we will make sure to unmute your line. Please note that this meeting is being recorded and we'll send out the slides and recording link via email after today's session. Would also love to learn a bit more about you, so please feel free to introduce yourselves in the chat by sharing your state, your organization, your title, and what brings you here today. Okay, so also please complete a quick 30-second pre-session evaluation that we're going to post on the screen right now. And this will only help us understand more about your current knowledge on today's topic. So you should be able to see the poll question on your screen. For those of you that are just joining right now, welcome, and please let us know your responses in the poll questions that we have on the screen right now. Okay, thank you, everyone. So we're just going to briefly introduce ourselves. My name is Filipina Sandoval, and I am the TTA manager here at NCHPH. I am moderating for today's session, and with me I also have my colleague Jumoke. She will also be helping with our moderation for today. And we also have our wonderful speakers, Catherine Stone and Chris Mackey. Would you like to introduce yourselves?
Go ahead, Katie.
Okay, thanks, Chris. Hey, everybody. My name is Catherine Stone. I'm a senior program manager at the National Association of Chronic Disease Directors, and I am with Chris here leading the Disability Network. I'm a white female in my 40s with dirty blonde hair. Here in the picture of me, it looks a lot more blonde. That is when I was getting my hair done more regularly. Chris, I will pass it over to you.
Thanks, Katie. My name is Chris Mackey. I am a senior project coordinator in community health at the Lakeshore Foundation. We're a technical assistance partner with NACDD and Katie for our national network on disability. And I am a white male. I'm bald. I have thin rectangular thin frame glasses, and I'm wearing a green polo shirt today. It's good to be here. Thank you.
Thank you, Chris. Thank you, Katie. All right, so for today's learning objectives, we'll be focusing on improving knowledge about the intersection of disability, tobacco use, and public health, and mostly on medically underserved populations. Also identify and collaborate with disability education and service organizations, and also apply clinical and programmatic strategies to make cessation. Oh no, but this is actually, my apologies. This is the overall learning objectives. But today we're mostly going to be focusing on the second bullet point, which is identifying disability-led education and service organizations. Sorry about that. Now I'll pass it on to Chris to get us.
Sure. Great. Thank you so much, Fide. Um, Again, my name is Chris Mackey. I'm with the Lakeshore Foundation, and just to give you a little bit of a sense of what we're going to talk about today, in my opinion, this is really as you expand your services and create your services to be more inclusive and more welcoming to people with disabilities. I think this is the most important aspect of that process, and that's partnering with people with disabilities to get feedback from actual individuals to help you be more inclusive and to get a sense of where you have gaps and where there are places that you can have improvement. There is a saying within the disability advocacy movement, nothing about us without us, and it's actually been updated to say nothing without us. So in that spirit, that's why we're talking about this topic today. It's really very paramount that you get direct input from people with disabilities about the services you provide. And that will also help you, as we'll talk about in a later presentation, sustain your focus on inclusion as you continue your services. Next slide, please. So I know we have a bit of a bigger crowd today than we did on our first presentation. So wanted to just introduce Lakeshore Foundation for those of you who couldn't attend the first time. But Lakeshore Foundation is a nonprofit, fully accessible fitness center that is also a designated U.S. Olympic and Paralympic training site. We serve as the governing body for USA Wheelchair Boccia, United States Wheelchair Rugby, and U.S. Para Powerlifting. So three Paralympic sports we are the home of. We're also the home of Lakeshore Sports Science and Performance Center that advances sports science research by providing athletes and athletes with disabilities training that combines science-driven services with expert knowledge, online resources, and cutting-edge facilities. Day to day, Lakeshore provides more than now 4,000 members with physical disabilities and chronic health conditions, and veterans as well, more than 90 different programs and opportunities to lead a healthy lifestyle through sports fitness and health promotion programming. Um, Lakeshore's work is grounded in not only research, but also advocacy. In the community health department, where I am from, where I'm based, we partner with the disability community to increase their focus on health, but also and primarily work with public health and health promotion providers to ensure that the services they provide are inclusive of people with disabilities. And that has been the point of this webinar series, is to really look at how do we build your capacity to serve people with disabilities in what you do. Next slide, please.
Okay, awesome. So from the last session, which was really a disability inclusion 101 type of session where we started at the baseline level of information, we had a homework assignment where we wanted individuals to think about the programs, the services, the resources that they offer to people that utilize their clinics or their facilities, and think about how we can make them more accessible and welcoming for people with disabilities. I am not sure if we have repeat individuals on the call, but if we do, and you did think about this and you identified some areas that you could increase accessibility, if you could throw that in the chat, that would be awesome if we could see. Since there's a lot of new people today, this is a reminder slide really as we go through the presentation and you think about what you offer and you think about the services. So for example, like a tobacco treatment program or a cessation program at your health center or clinic, thinking about from beginning to end, when you're promoting, when you have materials that feature individuals, are you featuring people with disabilities as well? to recruitment, enrollment, providing any counseling, to follow up, to the physical site, doing an assessment in your head about what you offer and then where can you make those changes to make it more accessible. So as we go through the presentation today, think about some of that and think about who you can partner with to help you achieve some of those goals that you might set.
And if you are new here too, and you have some idea of what you're coming here with an idea of what you want to look at and change and make more accessible to people with disabilities, please share that in the chat as well. Um, we'd love to hear your ideas and what you're thinking about it. What are you thinking about in terms of including people with disabilities now? And we'll continue to examine those issues as we proceed in the next couple of presentations. Next slide, please. So this is kind of the partnership is the sort of main idea and main topic of discussion for today. But and I understand if this feels like it's sort of an odd placement for this kind of information, but one, it's important and we have to include it at some point and somewhere. But effective partnership requires effective communication. And so to effectively partner with people with disabilities, you have to know how to effectively communicate. And the information that I'm about to present really is not only useful for working with partnership organizations, but also with your clients, your patients, your participants with disabilities. And so this is sort of universally uh, useful information, the idea of effective communication. So next slide, please. So the first kind, what we're going to do is kind of think about people with disabilities and think about disability conditions to say, think about conditions in categories. So, and particularly how your function is affected. And the first group of people we'll talk about are people with vision loss. And so when working with people with vision loss or blindness, there are easy strategies that you can incorporate. Simply identifying yourself and speaking directly when you're talking to someone and speaking directly to the person in a normal tone of voice can make communication more accessible. Another very important concept that you don't see or hear about is that you don't hear or see. My apologies. That you don't hear or see a lot about is how to be a sighted guide for someone with blindness and or vision loss. And so, how do you assist someone with vision loss? And essentially, what you do with that in that situation is understand that that person knows how to be how you can assist them the best. So what you would want to do, it typically is ask how you can help, and typically the person would grab your arm or your elbow, and you would be able to guide them around wherever you need to go. But being a sighted guide is another part of important part of effective communication with people with vision loss. And as we all know, people with vision loss or blindness often have a service animal, which can be a dog or a miniature horse in some cases. And it's important to understand that that animal is a working animal, and it's not appropriate to pet that animal without permission from their handler, from the person with vision loss. So, and it's also important that they are allowed in public spaces as long as the doing so it does not pose a danger to other people or to themselves. And so for most of the services that you provide, you typically are required to allow service animals into your facilities. Next slide, please. For people with hearing loss or deafness, make sure you have the individual's attention and that they can see you clearly, and make sure that they can see your face so they can, if they read lips, they're able to understand what you're saying a little even better. Remember, speak to them rather than to um, to their interpreter. So we don't speak to the ASL interpreter, for example, you speak to the individual. Another important concept when communicating, and particularly with things like the quit line, when communicating with individuals with hearing loss, is understanding the National Relay Service. The National Relay Service is something that um, is something that is provided by the federal government, by the Federal Communications Commission, and we all pay for it in a part of our taxes. And it allows someone with a communication disability who can't use a regular phone to communicate with you through an operator. And so you are communicating through a third party. And there are provisions within in the law that provide for HIPAA compliance when you're using the relay service. So in other words, if you are providing services to someone who has a communication disability and is using the relay service, if you get their permission to um, basically talk about their health concerns and talk about private health information um, before or at the very beginning, excuse me, um, that is considered HIPAA compliant, and that is considered um, being aware of their private health information, even though there is a an operator, a third person on the call. Um, Other couple of tips: do not talk at the same time as you write a message, and um, oftentimes, if you call a participant, sometimes it's a good idea to let the phone ring a little bit longer than usual. Next slide, please. For someone with a speech disability, the key here is to make sure you understand what the person is saying, of course, and don't assume that you know. Also, don't speak for a participant or finish their sentence for them, and asking questions that require brief answers can be helpful. And that's, of course, helpful for a lot of different individuals and just a good practice anyway, if you can if you can do that. Next slide, please. So for people with mobility disabilities, going back to those sort of simple strategies is important. Um, know that a person's assistive device is kind of like an extension of their body, so don't move it without permission. Always ask before offering assistance, as you would with any person with a disability or any person in general, really. And understand that ambulating for significant distances may be difficult and or take extra time. So it's important to be aware of that. And also, I think in this category, you can include people who may just have issues with fatigue, and so sitting for an hour of a counseling session may be difficult for some people, and so you need to consider. Do you need to restructure those counseling sessions, the tobacco cessation counseling sessions, so that they are that the person can participate fully? Next slide, please. Okay, so for people with intellectual disabilities, again, think of those simple strategies. Allow extra time to learn and master new tasks. This is very, very key. Um, Offer assistance with completing intake forms and any kinds of written materials that you may need. Um, of course, you may have someone who has um, may have a caregiver. Excuse me, I'm sorry. You may have a caregiver with them, and so they may be assisting the individual as well. Providing extra time for decision making, providing extra time to learn um, new environments, to such as if you're doing a telehealth session, they may need to work with their support person or caregiver ahead of time and or have some extra time so they can learn how to navigate that system as best they can. Using precise language and simple words, and then asking questions that require brief answers again is a good strategy in terms of effective communication. Next slide, please. Continuing the with adults with, or excuse me, with individuals with intellectual disabilities, always treat adults as adults. Be patient, be flexible, be supportive. It does take some creativity sometimes to present information in a way that is different than the way you typically do. Um, Take time to understand a participant and make sure that they understand you. Again, as you would with anyone with a communication disability, don't pretend that you understand if you don't. And if you are in an area with distractions, consider, is there a space that is a little bit more quiet for someone who may need to have a little bit more of a quiet space for them to focus on what you're saying and the education and information you're trying to provide. Next slide, please. So here's where we're kind of getting to the meat of the presentation here. Um, while this is a significantly, as I said before, while it's kind of a shorter part of the presentation, um, this is your first step in becoming more inclusive of people with disabilities, and that's partnering with people with different disability groups and different individuals. And what we're going to do today is actually give you a chance to um, learn a little bit about different organizations that are relatively widespread and might be worth looking at partnering with, and give you a chance to find where those organizations are in your states. Next slide, please. Okay, so there's basically three different baskets of organizations that you could partner with in terms of increasing partnerships with people with disabilities. So the first, starting from the left, the first sort of basket is government or public disability service organizations. So these are organizations that are offering in state government, maybe local government, but they include vocational rehabilitation, which is in every state, and that's an agency that provides assistance to people with disabilities in seeking gainful employment. Um, of course, every state is a little different, but you may have a state department of mental health, or a division or department of services for the blind or the deaf. Or just a general department of disability services. All of those state agencies have information on different agencies that can help you with providing inclusive services in what you do. University Centers of Excellence on Developmental Disabilities is a network of obviously university-based um, organizations that provide a variety of services to people with disabilities and their families, including clinical services. They do a lot of research on developmental disabilities and individuals with intellectual disabilities as well, and provide a lot of programming to increase independence for people with particularly developmental and intellectual disabilities. So that's a great network to tap into. Mayor's Office on Disabilities, Mayor's Offices on Disability. Not every municipality has these, but they are usually made up of primarily people with disabilities to advise local government on accessibility issues in the community and provide advocacy and support to community members with disabilities. Schools for the deaf and blind, I believe every state has one. Or some version of it. And these are organizations that obviously provide educational services to individuals who are deaf and blind, and can be resources where you find uh, Braille Braille formatting for your educational materials, or um, where you might find sign language interpretation services. And so those are good resources for the services that you would provide. State assistive technology programs, they are in every state. They're federally mandated, and they provide different kinds of assistive technology to people with disabilities who are in need of it. And usually it's in the form of a lending library where people can try out different kinds of assistive technology and eventually get to the point where they can purchase it, and they may provide financial assistance to do so as well. So I think the your state AT program that's going to be one of the organizations that we're going to have you give you a chance to look up in just a moment. Disability service organizations, these are not necessarily run by people with disabilities, but in many cases they have a lot of staff with disabilities, and they provide services sometimes to specific groups or sometimes to what we call a cross disability representation or group of people with disabilities. So these include the ARC of the United States, uh, Easter Seals, um, and those two organizations are one of the are organizations, excuse me, that provide services to a broad range of people with disabilities. So and oftentimes it's people with multiple disabilities, so intellectual and physical disabilities, for example. Special Olympics is probably one that most, if not all of you have heard of, and they provide athletic and health promotion opportunities for people with intellectual disabilities. And they have state and local chapters all over the country, and we'll give you a chance to look those up as well. And then there are, as I mentioned, there's disability-specific organizations such as the Autism Society, National MS Society, the Spina Bifida Association of America. All of these have chapters. Muscular Dystrophy Association of America is another one. Um, and then finally, and in my opinion, and I am a wheelchair user, I have a disability myself, so perhaps I'm a little biased, but I think partnering with disability-led organizations is paramount. I think you get, again, it's really critical that you get input directly from people with disabilities, and these are some organizations that do exactly that advocate on behalf of people with disabilities because they have the disability experience, the personal experience. So the first group of organizations are called Centers for Independent Living. This is another federally mandated group of organizations, and these are disability-led organizations that are for people with disabilities, and they help people with disabilities live independently in the community. The second group is the Consortium of Citizens with Disabilities, and this is a sort of a collection of different disability organizations that advocate for disability-related issues, uh, and really are involved in influencing policy and legislation. ADAPT is a long-standing group of disability advocates, and I've heard them called sort of the militant wing of the disability rights movement. Um, ADAPT are the ones that really have been a strong force behind disability rights laws like the Americans with Disabilities Act and Section 504 of the Rehabilitation Act, and have had a long history of um, protesting on behalf of people with disabilities, but they also function in many ways like Centers for Independent Living. They provide a variety of advocacy services, perhaps not as much technical services as SILs do, but are great organizations to get to know. The American Federation for the Blind has chapters all over the country, and they focus on uh, obviously serving individuals who are blind. And then Self Advocates Becoming Empowered, or SABE USA, is an organization that is really focusing on empowering people with intellectual disabilities and promoting self-advocacy for people with disabilities. Next slide, please. Okay. So now, I think, Katie, we want to talk about how
Yep,
uh, we'll give people a chance to look these things up.
sure. Okay, thanks, Chris. So that was really good information, a lot of information. Um, just a little bit of background for all of you. My background is working at a health department, a city health department, a state health department, even the Department of Aging for Columbus, Ohio, or Ohio itself. And I know at one point in one of our grants, it requested that we work with people with disabilities. And I remember being really lost in how to do that. I had no idea, and I didn't have training either. So I did the best I could. But these organizations that Chris mentioned, these are gold. Like these people can really help. They're available and they're in your communities. So just keep that in mind when you're forming coalitions and work groups and whatnot. These are the organizations you can tap into. So at this moment, if you could all scan one of the QR codes on the screen. Earlier today, I scanned the Easter Seals one. And I know when I scanned that, it had an area where I just put in my zip code. And I mean, even to my surprise, right now, and I'm doing this work, there was so many Easter seals around me in Columbus, Ohio. So that makes it easy if I need to partner, if I want to partner with people with disabilities, with organizations that serve or advocate for people with disabilities. They're all around the area here. So if you could take a moment and scan one of these and see what's in your area, and if you could raise your hand if there is one of these organizations in your area. So just raise your hand so we can see that you have scanned it and that you notice what's around you and what partners you can tap into.
And if the QR card codes aren't working or you don't have your phone, I put the links in the chat.
Thanks, Sally. Okay, good, good. Okay. And then Chris, if you want to go to the next slide, or if next slide,
Meeting.
please. Okay, so now these are those sills that Chris was talking about, and I put the abbreviation in the chat. So, Centers for Independent Living. This is going to be another really great organization that you can tap into. So there's a national organization, and then there's local chapters. So the Centers for Independent Living is a really good one if you want to scan that one and see. I'm actually going to do that right now.
And the National Council on Independent Living, which is the national sort of organizing body for CILs or Centers for Independent Living, and the Association of Programs for Rural Independent Living, or APRIL, are both on our national network
Mhm.
for our disability network.
And they provide so much information and help. So,
Yeah,
like when we produce a document, they review and they put that disability inclusion and accessibility lens on our document, and they make recommendations for how to make sure that it is accessible and it represents individuals with disabilities. So, just from looking at what I pulled up here, all the states have numerous centers for independent living.
right.
That includes their phone number, their email. So take a look at that and see what resources you have in your community with the Centers for Independent Living and the state assistive technology programs. And these slides will be sent to everybody afterwards, so
Yes.
you can have access to this information to pull up when you're planning committees or work groups. Next slide, please. Okay, and then
Okay.
Chris will take over with some of the inclusion expertise.
And I do want to also just say too that particularly those organizations that are primarily led and run by people with disabilities, they can tell you how they can help you. If you're unsure sort of how to partner, um, but you want to make your services more inclusive, invite individuals to, a meeting or to, an advisory group or whatever the case may be. And they can tell you where you have your gaps. Um, and so don't be shy about approaching disability-led organizations. But it's also important to remember that even outside of those organizations, there might be individuals in a community that you could tap into. So, for example, schools have adapted PE teachers, they have special education teachers, both of which have expertise. They may not have a disability themselves, but they have expertise in how to include people with disabilities in different environments. And they do that every day. So that expertise may be helpful to you. In healthcare, you have occupational therapists, physical therapists, recreation therapists, even speech therapists. Um, Individuals who every day adapt activities and environments so that people with disabilities can be more productive, can live, a productive life, and or as productive as possible. And so that is expertise that you can tap into as well. And then community organizations, a local Parks and Rec. We mentioned Special Olympics, but maybe a local Parks and Rec has a Special Olympics chapter within it. And so that may be a group you can tap into, or maybe they have a recreation therapist who, again, is another individual, another professional that adapts uh, activities and programs on a regular basis. And so that adaptation expertise just generally is very, very helpful, even though individuals may not have a disability. Next slide, please. So this is applies obviously to only a select group of states, but there are, I believe, 10 or 11 states across the country that receive funding from the CDC to specifically focus on health promotion for people with disabilities, and from a public health approach like we do at Lakeshore. So not necessarily looking at providing direct services, but again, how do you build capacity for people, for professionals, so that they're more inclusive of people with disabilities? And so the states are Georgia State University, Massachusetts Department of Public Health, the Michigan Department of Health and Human Services, uh, the curators of the University of Missouri on behalf of UMKC, Montana Department of Public Health and Human Services, excuse me, University System of New Hampshire, the Research Inc., New York State, so the New York Department of Public Health, Ohio State University, and particularly they're housed at the Niswonger Center, or Oregon Health and Science University, and then the Utah Department of Health. So those are the 10 states, and another really, really good group, if you're able to, group of organizations, or perhaps your own state organization that you can tap into. They have the expertise that bridges the divide between public health practice and disability inclusion. Next slide, please. So I think we mentioned this in the first session, but remember, when you are looking at your programming, you want to look at 5 different areas: the built environment, the services you provide, the instruction, equipment and technology, and the policies. And I think most importantly, the policies that you have in place that support and sustain your focus on inclusion. And all of those we'll talk a little bit about more in the next session, but we gave a few examples in the first session looking at each of those areas. Next slide, please. So one of the things that we want to do is really get you thinking about how do you um, how do you focus on, or how do you create a plan of action? Um, And so we're going to give you a couple of examples of how to sort of approach uh, addressing a barrier that people with disabilities may face. So in many cases, with the health education materials and the services that you provide, many people with disabilities may not be able to understand the information that you're providing in the way that you're providing it. And so, for example, an individual may need large print versions of your educational materials. Maybe they need simplified versions and easy read versions of your materials. Uh, Maybe they need something in Braille. And so first thing obviously you have to do is identify what area you want to address services and what you want to do within that area. You want to address alternate formats. And then the strategy or sort of the steps that you would take would be to identify a partner to support all strategies throughout. So again, going back to those disability organizations that we talked about and making sure that you work with them and they're involved in the whole process of creating alternate formats. Um, Making sure that you budget for materials, and maybe you can't make everything accessible right now, but what are the most important pieces of information that you offer to your patients that needs to be made more accessible, and focus on that, and then budget for future and additional pieces to be made more accessible. Identify a vendor if you need it. And so sometimes you need to identify someone who has the ability to create a Braille version of your materials, for example. And then even before you do that, what I would say is utilize your partners, as Katie was talking about, utilize your disability partners to review your materials. Let them give you some input about what needs to change before you even go and make the final product. And then produce have the new materials produced and then promote them. Make sure that whenever you improve access in any way, that you are letting your clients, your patients, and the general public know that you have those services available. And then, of course, um, you know, always have a reason why you're doing what you're doing. And so, really pick pick something that is achievable and build towards making bigger changes. Create a plan that, where and we'll talk about this in another presentation, but where you're looking at what are you going to do within the next month? And then what are you going to do over the next year? And what do you need to budget for and think about over the next 5 years, for example? So just think strategically when you're looking at removing barriers to disability inclusion. Okay, next slide, please. And another sort of way to sort of organize yourself as you're addressing including people with disabilities is to think about things just logically, but make sure that you're organized. So what are the steps, as we saw on the previous slide, what are the steps you need to take, but identify someone who's going to be responsible. Make sure that your director or whoever's in charge of health education, whatever the case may be, the person that you identify a person responsible for this process of creating more inclusive materials and services. Give yourself a timeline, and give yourself a measure of success, and maybe even break that down a little bit and track your progress, as it says at the bottom there, and where are those smaller um, instances of success or milestones that you can record before you have a new service that's more inclusive. And always, again, be thinking about partnership and the support that you need and the support that they could provide. Next slide. Next slide, please. Excuse me. And Katie, or I think you were doing this one?
Yeah, I was actually doing the ones before as well, but I'm
Okay.
not mad at it.
Okay.
Okay, thanks, Chris. So this slide here is from the CDC. It's just a reminder to be an ally. So acknowledge and respect individuals' experiences and abilities. Learn about the different disability types. So you want to make sure that when you're thinking about your programs, you are thinking across the disability types and assessing for those disability types. Leverage your influence to promote accessibility and inclusion, and yield the floor to people with disabilities to help identify and eliminate barriers. Next slide, please. So, NACDD has a tobacco resource library. And on that library, we do have a fact sheet for partnerships. So you can scan this QR code or click this link here, and you have access to that fact sheet. We have lots of resources on tobacco and health systems change. We also have resources for tobacco and disability inclusion specifically. So poke around on that website. There's a lot of really good information there. Also, if you look around on that website and you see that we're missing something and you have a good resource, feel free to share it with me or Fide, and we would potentially put that on our website as well. Next slide, please. So now we are at the Q&A session. This is your time to ask us questions. If anybody has any questions, feel free to put it in the chat or raise your hand. Not hearing or seeing any questions. As a reminder, you are able to follow up through email if you do have questions. If you start creating an action plan or reaching out to partners and you have questions at that time, we're always here to answer those questions, provide some technical assistance if needed, one-on-one, if we have the capacity to do that. Next slide, please. So, Fide, do you have that post evaluation?
Yes, yes. So you should be seeing the link in the chat. Jumoke will be pasting it right now. So please complete our post evaluation survey. And let us know what your thoughts are for today's session. The link will also be provided to you in a follow-up email that you should already have received. So the survey will be closing tomorrow. So any responses that we can get today, that will be very helpful. And thanks everyone. And thank you, Chris. Thank you, Katie. I don't see any questions so far or anything that has come in the chat yet. Jamoka, do you see anything in the Q&A?
No, I'm not seeing anything.
Okay, thank you. All right. And thanks everyone. Here's just our disclaimer about NCHPH. And I would like to just remind everybody about our next session, which is happening also next week on the 23rd at 1 p.m. So we look forward to seeing you all next week. And here's our direct contact information. And that is it for today. So thanks everyone. If we don't have any questions, Katie or Chris, do you have any other closing remarks so far?
No, just appreciate everybody for joining. Thanks for taking the time today, and we hope to see you at the next call.
Yes, thank you.
Thank you. Thanks everyone.